Welcome back, Matt. Good to see you.
Good to see you too, Dr.
So we're here for a head-to-toe assessment for you today. When is the last time that you had such a procedure done?
About 8 months ago.
8 months ago. Okay. And may I please have your first name and then date of birth to make sure that I have the right medical chart?
M.A.D. June 2nd, 89.
All right. Mad. So anything bothering you with your health? Anything you would want me to focus on in particular during today's session?
Yeah, I'm having a lot of pain. It's radiating towards the bottom right and left side.
Okay.
And also I've been experiencing some very itchy scalp areas. And I feel like it's kind of traveling from left to right.
Okay, the back of the head here?
Yeah.
Okay, let me just feel. Okay. Do you experience those sensations right now?
Yeah.
Okay, so lower back. And when did the lower back symptoms start?
About 3 months ago.
3 months ago. And the scalp?
Could have been the same time, but it was after the back pain.
Okay. On a scale of 1 to 10, how intense is your back pain?
4.
4. Okay. Does it wake you up at night?
Definitely.
Okay. Do you feel like you're able to go through your daily activities just fine, or does it keep you from just being functional during the day?
I can function, but honestly, it's a very low pain that it starts to be intolerable.
Okay. Have you changed your shampoo or conditioner in the last 3 months?
Not lately.
Okay. Are you on any medication right now on a daily basis?
No, just daily vitamins.
Daily vitamins. And those are just over-the-counter vitamins?
Correct.
Okay. Any blurred vision or double vision, especially when you're experiencing the back pain here?
No.
Okay, so not accompanied by any other pain. Do you feel like your eyes are getting itchy or dry when you experience the scalp sensations?
No.
No. Not accompanied by any other symptoms. Okay. Any flu-like symptoms in the last 2 weeks?
No.
Any major surgeries? I haven't seen you in a couple of years, so.
I had a wisdom teeth removed.
Okay.
On the right side. Otherwise, no surgeries.
Wisdom tooth removal. All right, Matt. So what I'm going to do today is perform a head-to-toe assessment, and I'll focus on your cranial nerves as well as your dermatomes. So dermatomes are areas of the skin that are innervated by the same spinal nerve. So I'll check those out in your face, your scalp, and your chest.
Okay.
And focus on your back as well.
Okay.
Okay. And do you feel those sensations on your scalp right now?
Yes.
Okay. On a scale of 1 to 10, with 10 being the most intense, what is their intensity right now?
4.
Alright, so let me just go ahead and feel your head as well as the back of the spine here and check for any lumps, bumps, or any abnormal sensations to my touch. Checking C1 and C2 at the top of your spine. And your neck. Any pain when I'm pressing down on your C1 and C2?
Yeah.
Okay. I'm not feeling any lumps or bumps, so no hidden masses. Okay. Pressing down on your mastoid bone process. Any pain there?
On the right side and left.
Okay. Okay, checking your neck for any masses as well or indentations. Good. Cervical and occipital lymph nodes are not enlarged. And preauricular, posterior auricular, submandibular, submental. Okay, good. All right, I'm gonna just listen to your heart first, as well as your lungs. Have you noticed any shortness of breath or any heart palpitations that give you trouble?
No.
Good. Okay. So go ahead and just breathe normally. Just gonna take a little listen to your heart. Good. So I'm hearing all normal sounds, no murmurs, no extra sounds. Good. Now take a deep breath in. I'm gonna listen to your lungs. And out. Good. Deep breath in and out. Good. Deep breath in and out. Good. Perfect. So lungs in the front sound normal, and heart checks out as well. So I'm just going to take a couple of notes here. No wheezing, no crackling, no signs of any pneumonia. And then your heart, S1 and S2 could be hurt. Okay. Also going to check your temperature. This is going to go over your forehead and behind your ear. Good. 98.3, so definitely you don't have a fever. And let's check your oxygenation as well. So this is your index finger into my device here. You can just rest it on your leg. And I'm going to check your brachial pulse. 6, 7, 8, 9, 10. Good. And you're choroided as well. 3. Good. So rhythm is normal, not hyperdynamic or thready or weak. 99% oxygenation, 85 beats per minute, so good rhythm to your heart. Okay. I'm also going to check your reflexes since you're in the right position for that. Go ahead and close your eyes and open your mouth slightly. I'm just going to tap lightly on it. Good. Then tap on your shoulders. Good. Good. And I'm going to tap on the top of your head to check for any abnormal neurological responses. Good. To the sides of the head. Good. Good. Any pain when I was doing that?
No.
All right. Go ahead and relax your arm. Good. Good. Can you uncross your legs, please? Good. 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 Perfect. All right. Very good. Next up, I'm just going to observe your skin and just focus on your arms. So if you can just keep your eyes closed and relax. I'm looking for any neurological signs that could manifest in the form of redness, irritation, on the upper part of your limbs here. Okay, let's check your face too. Look up for me. Just going to take a peek at the base of the eyes. Good, clear eyes, white, conjunctivitis, pink and moist. Okay, you can close your eyes now. Good. Okay, just going to look in the inner part of your arm. Okay, good. Then over here as well. Okay, good. So no abnormal skin symptoms. All right, I'm gonna check your eyes next. If you can just open them for me. Just gonna do a couple of tests. So looking right here and try to keep your head steady. I'm going to check for your pupil response. Okay, good. 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 So pupils are round and reactive to light. I'm going to check for the direct and consensual response. Keep looking right here. That's direct and consensual. Good. And over here too. Direct. Good. Perfect. All right. Now I want you to look into the distance. I'm just going to observe your eyes from the side and check for any bulging or any jaundice. Good, perfect. All right. When is the last time that you had an eye exam done, Matt?
About 5 years ago.
5 years ago. Okay. Well, let's check your vision really quickly. I want you to cover one eye, and I'm going to mirror you. And I want you to tell me when you see my fingers escape your field of vision.
No.
Good. And now when my fingers enter your field of vision.
No.
Good. Now let's do the same. Cover the other eye. Okay. Fingers out of the field of vision.
No.
Good. Fingers into the field of vision. Good. Perfect. All right. And now I want you to continue looking into my eyes. And I'm going to elevate my finger right here. And I want you to try to touch it with any one of your fingers while looking at me. Good. Perfect. Now over here. Perfect. Perfect. Good. And now touch right here and touch your nose. Good. It's a good balance. All right. Next up, I'm going to use my ophthalmoscopy right here and take a peek in the back of your eye and check your optic nerve and optic disc. Okay, we're gonna need this in a second for the ears, so I'm gonna put it right there. Let me turn it on, and you can just look into the distance. I'm just going to first make sure that I have a clear view of your eyes. Then I adjust my device here. Oh, it's a little bit blurry. Hold on. Oh, that's perfect. Okay. So I'm going to come really close with my device. So go ahead and just continue looking into the distance. I'm going to just take a peek right there. Okay. Cone of illumination is present. No redness. Optic disc is intact. I'm seeing a good ratio, so this eye is perfect. I'm going to do the same in the other one. Okay, so let's take a peek into this other eye as well. Okay, beautiful brown eyes. Perfect. Okay, I'm going to come really close. Okay, let me just pull a little down. Good. Look up for me. Look down. Forward. Okay, good. Okay, so let me just make a couple of notes. Eyes look good. This clear eyes white. No discharge from your conjunctiva. The optic disc is intact. Conal flight was present. And also a good ratio in the optic disc in both of your eyes. Okay. So what I'm going to have you next is put on the medical gown, and I want you to lay down, face up, and we'll continue the exam. Okay, Matt, I'm going to check your ears next. And I'm just going to palpate the front of the ears. And at the top. Okay, good. I'm going to turn on my otoscopy. Just take a peek inside. If you can just tilt your head towards your right, perfect. Okay. Good. I can see all the bony landmarks, and tympanic membrane is pearly gray, not inflamed. Good. Right, and if you can move your head towards your left, I'm gonna take a look in here as well. No inflammation or discharge, just a little bit of wax buildup. the normal amount and physiologically normal tympanic membrane, which is pearly gray. Good. All right, you can come back looking towards your right. Okay. I'm gonna go ahead and check your sinuses. Just going to palpate. The top here is a little bit inflamed. Do you usually suffer from allergies?
No.
Okay. Now I'm feeling some puffiness here. Any pain there?
No.
There?
No.
Good. Okay. Might just be allergies. Okay. Checking the adenoid and sphenoid sinuses here. Good. And the maxillary sinuses. Any pain there?
No.
Good. Okay. I'm going to do some light tapping on your face to see if there are any positive neurological reactions. Good. Okay. No reactions noted. Okay, I'm going to take a look at your scalp next, starting with the top of your hairline here. And then I'll work my way back towards your neck, nape, and spine. Alright, so I'm going to focus on the top of your head here. Just going to inspect your skin. I'm not seeing any redness. Just a little bit of dandruff, but in the normal amount. Okay. Can you count how many taps you feel?
2. 1. 1. 3. 4. 6. 1.
Okay, good. Now I'm going to apply some pressure, and I want you to say yes when you feel it.
Yes. 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 Yes.
Okay, good. And now I want you to tell me if you feel that pressure towards the right or the left of your hairline. And this is the hairline right here. Okay, so let's begin.
Right. Left. Right. Left. Right. Right.
Okay, good. Now I have here two different devices. One is cold and one is warm. Tell me if you feel warm or cold.
Cold. Warm. Warm. Warm.
Okay, good. And this is dull and this is sharp. Do you feel the difference?
Yes.
Okay, go ahead and say sharp or dull.
Sharp. Sharp.
Okay, good. Let's take another sample of your hairline. Maybe towards the side here. Or towards the center. Center right. Okay. Is this sharp or dull?
Sharp.
Okay.
Sharp.
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 Okay. And am I touching you with two pressure points or just one?
Two. 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 Two.
Okay, very good. Okay. Alright, let's go ahead and flip face down so I can take a look at your back.
Okay.
Alright, Matt, I'm gonna take a look at your hairline here next. Just checking the strength of your hair strands and looking for any breakages, any patches of hair loss. Good. Not seeing any alopecia signs and no excess dandruff on the side of the hair. Okay, is this sharp or dull?
Dull.
Dull. Okay.
Sharp. Dull. Dull. Dull.
I'm going to touch you with two different textures. One of them is wet and the other one is dry. Go ahead and say wet or dry. Wet. Dry. Wet. Dry. Okay, good. Now let's take a look at the back of the spine too here. Is it okay if I unbutton your gown?
Yes.
Okay. So I'm first going to visually inspect your back. Looking at the short shoulder blades, the scapula. I'm not seeing any blue or gray colors, no redness. Checking the nape area as well. Okay. So no visual signs of any abnormalities. I'm going to go ahead and palpate the back. But first I'm going to check for any skin indentations. That I may have missed. Okay, I have one big mole here. One color, well-defined borders. Is that painful?
No.
Okay. Okay. Good. So not noting any indentations. I'm going to go ahead and palpate your spine. Check for any lumps, bumps, or deviations of the alignment. Okay. So C1 to C5 do not present any indentations. T1, T2 are okay. Going down to L1, L2. Good. All right, and now let's check the back of the spine here where you mentioned that you feel the sharp shooting pain. Okay. So I'm checking your L12 and 11, and I'm feeling some bumps over here and a slight deviation of the spine. So you may have the beginning of scoliosis. Okay. Let's check your dermatomes in the back of the spine here. Can you tell me if this is sharp or dull?
Dull.
Okay.
Dull. Sharp. Dull. Sharp. Dull.
Okay.
Dull. Sharp. Sharp. Sharp.
Okay.
Dull.
All right. Next up, I'm going to cause a vibration, and I'm going to test for the changes in pressure, and I want you to tell me when you stop feeling the vibration.
No.
Okay.
No. No.
Good.
No.
Good. Okay, now I want you to tell me if you feel the vibration on your left shoulder blade or your right shoulder blade.
Left.
Good.
Right.
Good.
Left.
Good.
Right.
Good. Okay, and now I want you to tell me if you feel this sensation continuously all the way to the top of your spine.
Yes.
Okay, good. And how about this one?
Yes.
Good. And this one?
Yes.
Good. And this?
Yes.
All right. And this? Okay, good. Now I'm going to apply localized pressure, and I want you to count how many times you feel me applying that pressure. How many
2.
was that? 2. Good. How about this?
3. 2.
Good.
2. 2. 1. Did I feel that?
So there is a loss of sensitivity in the lower back here. Okay, did you feel that?
Yes.
And how about this? How many times am I poking you here?
2.
2 times, okay. So L12, L11 area is where the numbness and the sensitivity loss is localized. Okay. Is this cold or warm?
Cold.
Okay. And this?
Cold.
This?
Cold.
Okay. I'm going to go ahead and listen to your lungs as well. So go ahead and take a deep breath in and out. Deep breath in. Out. Good. Okay, you can just breathe normally. Good. Good. And checking the base of your lungs. Okay. Good. So no crackling or wheezing in the base of the lungs here. Next up, I'm going to check the capacity of your lungs. So I'm going to place my hand right at the base of your thoracic cavity here. So take a deep breath in for me. And blow in, yes. And then release. Okay, another deep breath in and release. Okay, good. All right. I'm going to button up your gown next, and I'm going to take a look at your legs and your feet. All right, Matt. Next up, I'm going to take a look at your legs. And first I'm going to check the popliteal pulse. Okay, good. And check for any signs of edema in your legs by pressing down. You do have a little bit of swollen legs. Do you usually get any water retention? Do you suffer from?
I haven't noticed that.
You haven't noticed that? Yeah, they're a little bit swollen, but I'm not seeing signs of edema. Just feels like you're retaining a little bit more water than usual. Do you have any pain in your feet right now?
No.
Okay. Your feet are a little bit cold. Okay, pressing down on your plantar region. Any pain there?
No.
Okay, good. Okay. So definitely cold and getting warmer towards your knees. Okay. I'm gonna check your pedal pulses. 2+ synchronized. Okay. And I'm going to check in between your toes. Inspect the area. Good. The nails look healthy. No signs of any clubbing or pitting. Any pain there when I'm tapping on your nails?
No.
Good. Okay. All right, so looking healthy at the first glance, I'm going to press into your pads there, the bottom of your feet. Can you push into me? Good, perfect. Now I'm going to attempt to spread your feet apart, so don't let me do that. Resist, good. And I'm going to press 4 toes towards me. I want you to push your big toe towards you. Good, perfect. And we're going to do the same on your left leg. So bring your toes, big toe towards your head. Perfect, good. And now I'm going to press down on 4 of your toes. Bring both of your big toes towards your head. Okay, can you do it a bit more? Perfect, good. Okay. Just check your sensitivity. I'm going to slide a slightly cold object on your legs here, and I want you to tell me if you feel anything that's bothering you, any pain or any sensation that's unpleasant.
No.
Okay, good. 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 And is this sensation continuous?
Yes.
Okay, all the way up to here?
No.
Okay. All right, patient does not note any pain or jolting sensations. Good. All right. I'm going to do a little tapping, so this is going to be slightly more intense sensation. I'm looking for any abnormal neurological responses. Okay, good. Hue is good. Tibial bones are intact, and the metatarsals are normal as well. Okay, good. Now I want you to flip face down so I can take a look at the back of your feet and legs. Okay. So let's take a look at your calf muscles here too and check for any edema. Okay, I'm seeing the same temperature gradient that I noticed earlier where your feet are very cold, but your legs and moving up towards your limbs is getting warmer. Okay, before I do anything else, let's check the Babinski reflex. I want you to just leave your foot loose. Good. Foot loose. Perfect. So no positive Babinski. I'm going to touch you with 2 textures. One of them is cold and the other one is dry. So I want you to say wet and cold or dry.
Try.
Okay, interesting. So no differentiation between wet and cold and dry. So that's definitely a loss of sensitivity there. Okay, can you tell me if this is sharp or dull?
Dull.
Okay.
Dull. Sharp. Sharp. Dull. Dull. Sharp. Sharp. Dull. Dull.
So plantar region is definitely not attuned to the sharp sensation. Okay, can you wiggle the toes for me? Okay, so you can wiggle them. Good. Okay, you can sit up now. We can continue the exam. And so you definitely mixed up some of the sharp or dull sensations, as well as you couldn't differentiate between wet and dry on your legs. So there's definitely some nerve damage going on with you. The back as well, you had some loss of sensitivity around the L12, L11 vertebrae. So I'm gonna go ahead and check your dermatomes a little bit more in depth and focus on your face, your chest, and your legs here towards your thighs and your knees. So let me go ahead and ask you to close your eyes, please. Do you feel this sensation?
Yes.
Okay, so that's dull. And do you feel this?
Yes.
That's sharp. Okay, so let's go ahead and try to see if we feel sharp or dull.
Sharp.
Okay, good.
Dull.
Okay, good.
Sharp.
Good.
Dull. Sharp. Dull. Sharp. Dull.
Okay.
Sharp. Sharp.
Okay. And is this cold and wet or dry?
Cold. Dry. Cold. Dry. Dry. Cold. 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 Dry. Dry. Cold. 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 Cold.
Okay, let's go ahead and open our hands.
Cold. Dry. Dry. Cold. Dry. Cold. 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 Dry. Dry. Cold. Cold. Dry. Cold. Cold. Cold.
Okay, Matt. So there's definitely some sensation, sensory losses that you're experiencing. So I'm going to go ahead and order a complete blood panel for you, as well as an MRI and a CT scan. And let's review those results, and then we can think of a treatment plan for you.
Okay.
All right, do you have any questions for me today?
No.
All right, great seeing you, and I'd like you to be back in about 2 weeks so we can discuss those results.
Thank you.
Hi Harita, welcome back.
Hi.
So we have an appointment for a head-to-toe examination today. It's been a couple of months since I last saw you. How have you been?
Good. How have you been?
Good, all good. Just busy as usual. Any particular reasons why you booked this appointment today? Anything bothering you?
Nothing too serious. Just an overall checkup.
Good. Okay, so no changes to your overall health. And last time you were telling me that you've been having some trouble falling asleep and just sleeping overall. How is that going for you?
It's a bit better. I'm still definitely having trouble falling asleep. Like, I've been taking melatonin.
Okay, that's good.
It hasn't helped too much.
And how many milligrams of melatonin are you taking every night?
Usually like 5 milligrams.
5 milligrams, okay. So that's a good dosage. I would also recommend that you try some magnesium as a supplement about an hour before going to bed. That should help relax the muscles. And any changes to your medications? Are you on any new medication?
I'm not.
No new medications, okay. Alright. Any new allergies?
I don't have any allergies.
No allergies, okay. Do you follow a certain diet? You mentioned that you're vegan last time.
Yes, I am vegan.
So you're still following the same diet? Okay. And I see that we have your blood test results, and vitamin B and D were within normal range. Okay. Have you experienced any problems with your vision since I last saw you?
I do have astigmatism.
Astigmatism.
In my left eye.
Oh, okay. I did not have this in the chart for you, so that's good.
Yeah, I recently found out.
You recently found out?
Yes.
Did you maybe have an eye exam?
I did have an eye exam.
Okay. Good. And are you wearing contacts? What is the state of your vision?
Yes, I'm wearing contacts right now. Yeah.
And how's that going for you? Any dryness in the eye? Any irritation?
There is a bit of a dryness because I'm just starting to wear them, so I'm getting used to them.
Okay. Going to make a note of that. Any blurred vision or double vision after you started wearing the contacts?
Yes.
Okay.
Blurred vision.
Blurred
I'm
vision.
noticing that, yeah.
Does it happen during the morning, during the night?
Sometimes when I just put them in, I'll
After-
get blurred vision.
Blurred vision after you put them in. Okay. And how long does that last for?
Until like they settle in my eyes, like for the first few minutes.
Got it. Okay, so that's not concerning. That can be normal. There's an adjustment period for contact wearers, so maybe I would give it a month or two. And if that persists, then we should talk about it again at the next checkup. All right. Other than that, anything else bothering you with your eyes? Any pain?
Not with my eyes, no.
Good. Any issues with your hearing?
Sometimes I hear like a ringing sound occasionally.
A ringing sound.
Sometimes like after I listen to loud music, I'll hear that.
Okay. Do you know how long that lasts for?
For a good few minutes.
Okay. Have you noticed any discharge or any redness, anything with the skin on the outside of your ear or anything coming out of your ear?
No.
No, okay. And I assume you've not had any recent ear infections or anything of the sort? Okay. So we're going to go ahead and check your ears as well and your eyes. Any back problems?
No, no back problems.
Good. And do you work out on a regular basis?
Yep.
Good. Okay. Do you use tobacco or alcohol?
I do not.
No tobacco and no alcohol. Okay. Any difficulty breathing?
No.
Okay. Any tingling sensations or numbness in your skin, especially on your chest, your face, or your arms?
Sometimes I'll feel it in my feet.
You feel it in your feet?
If I'm like sitting for a long time, then I'll feel like a tingling in my feet.
Okay. So tingling sensations. The feet. So I'm going to go ahead and definitely check that out. Tingling sensations and numbness can be a neurological side effect of something going on with your nerves. Hopefully that's not the case, but we're going to go ahead and check your feet as well. Okay. Anything else that you'd want me to know before we begin the exam?
I think that's it.
All right. So I'm going to set this aside. And I'll go ahead and put on my gloves. And did you have breakfast this morning?
I did have breakfast.
Okay, do you remember what you had for breakfast?
I had a smoothie.
Okay, so short-term memory check. And may I please have your date of birth?
August 3rd, 2000.
Okay, so long-term memory checks out as well. So I'm going to go ahead and start by taking your vital signs, and I'll take a listen at your heart and your lungs. Put my stethoscope over here. Any heart palpitations, anything bothering you in the chest area?
No.
Good. Go ahead and sanitize the stethoscope. Right. And is it okay if I move the hair away from your chest? Alright, so I'm gonna just listen for any murmurs. Can just go ahead and breathe normally. S1 and S2 are present. I'm not hearing S3 and S4. Heart rhythm is normal. And I'm going to go ahead and use the bell sign as well. Okay. Good strong beat, not hyperdynamic. Good. All right. I'm going to listen to your lungs next. Take a deep breath in for me and out. Okay. Deep breath in and out. Good. Now you can just breathe normally. Good, so lungs are clear. There are no signs of bronchitis, no wheezing, so everything looks okay. I'm gonna go ahead and take your temperature next. I'm just going to sanitize the thermometer. Have you had any flu-like symptoms within the last 2 weeks? This is going to go under your tongue, and I'd like you to use your left hand to kind of hold it like that in place. Okay, go. And yep. And I'm also going to check the levels of oxygenation and your heart rate. And this can just rest right there. Perfect. So we're within the green, temperature-wise 97.3. And 99% oxygenation. So your blood is well oxygenated and 84 beats per minute. So your heart is rested and it is not overworking. Okay, let me just make a note of those vital signs. So 97.3 temperature, 99 oxygenation, 84 beats per minute. Then lungs and heart, normal signs. S1, S2 present. S3 and S4. Very well. So next up, I'm just going to take a look at you in a normal light condition and just observe your body and make sure that I'm not missing any bruises, any lumps, any indentations, anything that may require us to further investigate. Okay, so just taking a look. Do you have any pain right now anywhere? Okay. So, your skin is well perfused. There's no redness, no dryness. Check your face as well. Okay. Eyebrows are symmetric, there's no hair loss. No signs of psoriasis or dermatitis. Okay. I'm going to take a look at the inside of your arm. No moles that look abnormal. No signs of palmar erythema or red palms. Going to check the capillary refills. Less than 3 seconds. Good. Thyroid gland is not enlarged. I'm not able to see it, even when I look from the side. Perfect. So I'm going to go ahead and palpate your arms and your lymph nodes and your head and check for any lumps, any bumps, any hard patches of your body, any soft spongy patches. So let me know if you feel any pain. Okay, I'm going to start with your head. checking for symmetry and any major lines. Okay, good. Checking your cervical spine. Pressing down on your mastoid bone process behind the ear. No pain. Okay. Alright, I'm going to apply a little pressure on your head. Feel any pain there? Any pain there? Good. Alright, I'm not feeling any indentations. Okay, good. Any pain when I pull back on your ears? Okay, when I pull down. Okay, I'm going to check your lymph nodes next. Starting with the preauricular lymph nodes in the front of the ear. Okay. Then the occipital in the back. And the cervical lymph nodes on your neck. Okay. So I'm not feeling any enlargement, and the neck lymph nodes are mobile and barely palpable. Good. All right. Okay, shrug up for me. And shrug, move your shoulders up. Perfect, and down. Perfect. So the supraclavicular lymph nodes are not enlarged. Perfect. Okay. And the clavicles are intact. Alright, I'm going to check the auxiliary lymph nodes and the pectoral ones. Okay. Your armpit. Good, not enlarged. And over here. Good, not enlarged. Perfect. Okay, I'm going to check your arms for edema next. And checking your radial pulse and brachial. Good. As well as correlated pulse. Not hyperdynamic, not weak or trendy. Okay, good. Alright, so I'm going to focus on your eyes next. If you can look into the distance for me, I'm going to just flash my light for a quick second to check the pupil response. Alright, ready? Good. 1, 2, 1, 2, and across. Perfect. So pupils are round and reactive to light. They have the normal size and shape, and they look healthy. Okay. I'm also going to take a look in the back of your eye at your optic nerve, and I'm going to use my ophthalmoscope for that. Okay. You can continue looking in the distance while get this adjusted until I'm able to see you clearly. Okay, right there, perfect. So I'm going to come really close and just shine another light for a quick second. Okay, good. Okay. Optic nerve looks healthy. There's no cornea scratches. Your sclera is white. I'm gonna do the same over on this one. Good. Healthy optic nerve. Alright. I'm also going to take a peek at the base of your eye, and I want you to look up for me. Okay. Yep. I'm going to tug down on your eyelid, just a little bit. Check for any jaundice. Perfect, no signs of any jaundice. All right, I'm going to focus on your ears next. Okay, so I'm going to just use my otoscope for this. If you can look over to your left side. Okay. Checking the ear oracle. No discharge on the outside. No moles or anything hidden behind your ear. Okay, good. I'm going to take a look at the ear canal. Okay, the bony landmarks are present. Tympanic membrane is pearly gray with well-defined margins. No cerebral fluid buildup and no discharge or signs of infection. Just a little bit of wax buildup, but normal. Okay, I'm going to take a look in the other one as well. If you can move your head that way. Okay. Same observations, just normal ear oracle. And healthy tympanic membrane, normal ear canal. Wonderful. Okay. We're going to do a quick hearing test. And I want you to keep your eyes closed, and I want you to point to the sound that you're hearing. Okay, good. 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 Perfect. And now I want you to tell me when the sound stops. So when you stop hearing it. Stop. Okay, good. Stop. Good. Stop. Perfect. Okay, so hearing is intact. No concerns there. I want us to monitor the ringing that you're hearing sometimes after loud music. Just make a note whenever you hear it, when it happens, the activity that you're doing, as well as for how long it lasted. Okay, I'm going to focus on your nose and your mouth next. Have you noticed anything abnormal with your nose? Any discharge, any itchiness that doesn't go away? Good. All right, look out for me. Just gonna take a peek inside. All looks normal. Perfect. And I'm going to palpate your nose a little bit and just see if I can spot any nodules or anything that would be abnormal with your nose. Okay, so just checking the bridge of the nose as well as your ethmoid and sphenoid sinuses. Good. Bridge of the nose is straight. No indentations. tapping on your maxillary sinuses. Good. Any pain there? Good. Okay, and tapping on your frontal sinuses. Good. All right. Okay. So that looks normal. All right, let's take a look inside your mouth. And I'm going to use a tongue depressor for this. Set this right there. Okay. Anything bothering you with your throat? Any itchiness, raspiness?
Sometimes there is raspiness.
Raspiness, okay. Do you have any idea what might be contributing to this? Any?
Maybe cold drinks or cold food.
Cold drinks, okay. Yeah, that would explain it. Maybe stay away from too hot or too cold. Okay, so I'll go ahead and open your mouth for me. Just say ah. Okay, uvula is present. Not seeing any sores, no cankers. The teeth are normal. Can you stick out your tongue for me? Okay, normal tongue color. Can you touch the roof of your mouth with your tongue? Okay, no sores at the base of your mouth either. All normal. All right. I want you to puff out your cheeks for me. I'm going to do a quick test of your cranial nerves. So yeah, go like that. Perfect. And now release, and then go like that again. All right, and then I'm gonna attempt to press in on it. Don't let me do that. Perfect. Resist. Okay. And now lift up your eyebrows. Okay. Do they go any higher than that? Perfect. Okay. And I'm going to attempt to lower them. Don't let me do that. Excellent. All right. And finally, squeeze my arms. Okay. Tight, tight, tight. Perfect. And now try to turn a little bit while you're squeezing my arms. Okay. Well, you're strong. So no concerns with your back muscles. All right. Next up, I want you to lay down face up so I can take a look at your tummy. All right, are you comfortable? Okay, so you can go ahead and just relax for me. I'm going to palpate and auscultate your abdomen and also focus on your legs. And we'll take it from there. So I'm going to use my stethoscope first. Okay, just slide this right here. I'm listening for any gurgling, swooshing sounds, anything abnormal. Okay. I'm hearing activity in all four quadrants, normal bowel movement sounds, no swooshing. Excellent. Okay, I'm also going to listen to your aortic artery in the middle of your chest. Okay, perfect. Right. And your carotid artery on your neck. Good. Okay. So all normal sounds coming from your abdomen. I'm going to do a light palpation. And check for any masses. So I'm not feeling any masses, and the size of your internal organs feels normal. Okay. Liver is not enlarged. The spleen is not enlarged either. Alright, I'm gonna go ahead and percuss your abdomen and your chest, and I am looking for the resonance sounds, and I'm looking for just a normal bass resonance. Good. Kind of dull. That's what we're looking for, just same dullness all throughout. Okay, good. Going to do the same on your chest. Good. Checking your shoulders. And I'm also going to check your knees. Just going to palpate first. Okay. Not feeling anything abnormal. Patella in the front feels normal. Gonna go ahead and do some light tapping on your patella and your tibia bone. And the tibia bones. Good. So all is well with your patella and tibia bones. Okay. Checking for any signs of edema. Okay, very well. So your knees and your legs as well as your abdomen look normal. I'm not seeing any concerns. I want you to flip face down now so I can take a look at your back. Alright, so I'm going to move the hair out of the way. I'm going to go ahead and inspect your back. Looking at the skin, checking for any abnormal moles. No signs of any dermatitis, psoriasis, or any other abnormalities of the skin. No blues or purple colors are present. So no bruising or scarring. I'm going to check your spine, starting from the cervical spine. Checking if it's straight and if there are any nodules present in between the vertebrae. Okay. Alright, so no concerns with your back. I'm gonna go ahead and listen to your lungs. So just breathe normally for me. Okay, take a deep breath in and out. Okay, good. Lungs are clear, there's no swooshing or wheezing. Perfect. Okay, I'm gonna go ahead and palpate and percuss next. Good. So resonant sounds are okay. There's a tiny bit of a curvature here in your spine. It's not significant, but I'm definitely feeling it. Alright. So since we're right here, I'm also going to do a quick scalp inspection. I'm looking for any psoriasis, dermatitis, folliculitis, abnormal levels of dandruff, which are not present, any hidden moles, hair distribution is normal, the strand of hair is healthy, there are no abnormal breakages. No dandruff. And no hair loss during brushing which is indicative of a very healthy hair follicle. Alright, I'm going to go ahead and begin by inspecting your legs. And your feet. And checking in between the toes. Oh, and can you wiggle your toes for me? Perfect. And checking on your right foot as well. And can you wiggle these toes on your right foot? Perfect. Okay. I'm gonna palpate the plantar region next. I'm checking for any abnormal reactions to my touch, any redness or immediate swelling. Normal plantar region. Capillary refills within 2 seconds. Same response on your right foot. I'm going to do a little bit of tapping and check for any pain in the calcaneus region. Good. Checking for edema in your calves. No edema is present. I'm gonna go ahead and test your nerves. And I have here a dull object and a sharp one. So this is dull and this is sharp. Can you tell the difference? Okay, so go ahead and say sharp or dull. Sharp. Dull. Sharp. Sharp. Dull. Okay. And I'm going to touch you with an acupressure device, and I want you to just say yes when you feel me touching you. Yes. Okay, so neurologically your nerves are sensitive. There is an impulse that's being felt from the skin of your legs and feet all the way to your brain. So that's all working as expected. I'm going to go ahead and perform the Babinski test. So just keep your foot loose. Good. Negative Babinski. And doing the same on your right foot. Good, perfect. Okay, go ahead and stand up so we can discuss the results. I'm going to just make a couple of notes. Legs and feet were normal from a neurological point of view. You mentioned that you feel a little bit of tingling sensations in them after you stand for too long, right? Okay, so I'm not able to notice anything neurologically wrong, but I do want us to monitor those symptoms. So again, make a note of when you feel them, for how long and what you're doing, and then we can discuss within a month or two. But the back was good, your cranial nerves were intact, cardio and vascular systems working as expected, and no issues with your scalp, your hair, everything is normal. Do you have any questions for me today?
I do not.
All right, well, very nice seeing you, and we'll follow up in about a month.
Okay, sounds good. Thank you.
Welcome back, Amber. Good to see you.
Good to see you.
How have you been? What brings you in today?
Well, I've been feeling some like tingles kind of in my stomach.
Tingles in your stomach. Okay, and when did these tingles begin, Amber?
Maybe like 2 or 3 weeks ago.
2 or 3 weeks ago. Okay. How would you describe the sensation?
Kind of like pins and needle-ish.
Pins and needles, okay.
But not like really sharp.
More of a dull sensation in the background. Is it all the time that you feel it, or does it come and go?
It comes and goes.
Comes and goes. Do you feel any pain during that time?
Not really. It's more numbing, if anything.
Okay, so numbing, dull sensation. And is it mostly localized on your abdomen, or does it radiate anywhere else in your body?
It kind of radiates up, and sometimes a little to my legs.
Okay. Is your scalp affected in any way?
Sometimes a little bit, but not really.
Okay. How about your face?
My face is usually fine.
Okay. And your neck?
My neck's good as well.
So it's the chest and sometimes the scalp. Okay. Have you been doing anything new recently? Any new activity that you took up?
Well, about 3 months ago I took up ballet, but lately I've been tripping a lot during class.
Okay.
Which is weird because, I thought I'd get better at it, but I kind of been getting worse a little bit.
Okay. And the tripping, did that start at the same time as the tingling sensations?
A little before.
Okay. And when you have to walk normally, just if you're walking around your house, do you have any difficulty with that?
Not really, but sometimes I do trip.
Okay, so difficulty walking. And how about your coordination?
It's pretty good, except sometimes in my hands. I'll drop things, like if I'm writing, I'll drop the pencil, or if I'm on my phone, sometimes I drop my phone. Haven't broken yet.
Okay. So your finger mobility is also impacted. Do you feel the tingling sensations in your fingers?
A little bit, but it more feels like I'm wearing fuzzy gloves.
Feels like you're wearing fuzzy gloves. Okay. Do you feel that sensation right now?
No.
And you mentioned dropping your phone. How often does that happen?
Maybe 2 or 3 times a week.
Okay, well, do you have a case for the phone?
Yeah, luckily.
Okay, good. That's interesting that the finger mobility and the feet mobility is impacted. Have you taken any new medication recently? Anything over the counter, like vitamins?
No, I have not.
So no new medication. Have you noticed any other senses being impacted that other than the sense of touch?
Sometimes my ears feel a little off.
Okay.
Like when I get tingles, sometimes my ears ring a little bit.
Ringing in the ears. How about your sense of smell? Are you smelling?
I think so.
Okay. Have you noticed any excess sweating, especially at night? You wake up being,
sometimes I wake up a little sweaty, which is kind of weird.
Okay. Is that usual for you, or is that a new symptom that you're
It's
experiencing?
not usual now.
Excessive sweating too. Okay. Have you had any injuries or surgeries? Anything physically wrong with you?
Well, because of dance, I had an ingrown toenail, so I did have to get that taken out at the foot doctor. So there's a bandage on my toe, but it's all right.
Okay. And when did that happen?
That happened about 4 weeks ago.
4 weeks ago. And the symptoms started 3 weeks ago, so it's definitely after you had the foot injury. Okay. Alright. Were you prescribed any medication for that?
I was told to take over-the-counter pain medication, so I took a little bit of that.
Okay. Are you still on that now? Or?
No.
Okay. So the impaired mobility of your fingers and the lack of coordination in your legs, the tingling sensation in your feet, what you mentioned with your abdomen makes me think of peripheral neuropathy, which is condition where the peripheral nerves, so the nerves outside of your brain and your spine, the outside nerves are impacted by something. Could be vitamins sometimes if you're taking too much of that. Could be an autoimmune disorder. Could be hypertension. Were you ever diagnosed with that?
No.
Okay, so no history of hypertension. How about anybody in your family?
Maybe my great aunt, but I'm not sure.
Okay, so possible. Alright, so what I'm going to do is perform a neurological assessment. Focus on your abdomen and the dermatomes on your skin, on your chest, and on your face. I'm also going to do a scalp inspection and just do a head-to-toe assessment, clinical assessment, including your feet and your legs, and see if I can get to the bottom of what's triggering these sensations for you. I do suspect that we will need to draw some blood just to confirm this diagnosis if it does turn out to be the case. So we may need to run some blood tests. But let me go ahead and put on my gloves. Are you feeling those tingling sensations right now?
I'd say a little bit, like in my stomach area.
Okay. Do they radiate down your legs?
A little bit. They go like it radiates the same amount up my chest and down my legs.
Okay. So I'm just going to start by doing a visual inspection of your body first. Just make sure I'm not missing any external signs, any redness, any dermatitis, or any condition of the skin that may be contributing to this. So you can just go ahead and relax, and I'm just going to look at the skin first. Okay. I do see a little bit of redness, and the skin reacts to my touch. There's a little bit of inflammation going on. Okay. Your neck looks okay. Let's check out the arms too. Have you noticed any excessive sweating at night? Do you wake up feeling really, really sweaty?
Just a little bit.
Okay. Is it more than you would say the normal amount is for you? Okay. So a little bit of a redness on your chest area, but other than that, your skin looks quite normal. I'm gonna take a look at your face as well. Okay, go ahead and open your mouth slightly. I'm just going to tap really lightly to see if I can trigger any of those sensations on your face. Any pain? Okay, good. I'm going to tap on the bony prominences of your upper body as well. Let me know if you feel any sharp shooting pains or any intensification of those sensations.
Okay.
Good reflexes as well. Alright, I'm going to go ahead and palpate your head and your neck, and I'll be looking for any indentations, any lumps, any bumps, anything that could be a physiological sign of something going on underneath the skin. Okay, so I'll start with your head first. Looking for any hidden masses and checking the symmetry. Okay, pressing down on the mastered bone process behind the ear. Any pain there?
No.
Okay. Checking your lymph nodes. Okay, let's move your head towards your left. Checking the cervical lymph node and the occipital behind the ear. And towards your other side. Okay, preauricular lymph node and posterior auricular, occipital, superficial cervical, deep cervical, tonsillar, submandibular lymph node, submental, and supraclavicular. Okay. So no enlargement of the lymph nodes is noted. Okay. I'm going to check the inside of your arm. Okay. And check the pectoral lymph nodes. Okay, not enlarged. Very good. And over on this side. Okay, that looks good. Okay. Checking the pectoral and axillary lymph nodes. Okay, good. All right, I'm gonna go ahead and listen to your heart and lungs. Have you noticed any shortness of breath, difficulty breathing, heart pumping out of your chest?
Not really, no.
Okay, go ahead and just breathe normally. I'm looking for any murmurs. I'm able to hear the expected S1 and S2 sound and no extra sound. Okay, I'm going to check with the bell side as well. Okay, heart sounds normal. Go ahead and take a deep breath in. I'm going to focus on the lungs next. And out. Good. Deep breath in. And out. Okay, you can just breathe normally now. Okay. No hissing sounds, no wheezing. No signs of any adventitious sounds. Okay. Very well, so heart and lungs are okay. I'm going to check your pupil response next. You can look into the distance. I'm going to just check for pupil dilation and contraction. Very good. And now look at my nose right here. I'm going to check the concentric response. Good, perfect. So that looks quite normal. And in normal light conditions, your pupils are round. They have the normal size and shape. The skin looks to have the expected color appropriate to your ethnicity. I'm not seeing any obvious signs of anything physiologically being wrong with you. Going to go ahead and focus on your ears next. Have you noticed anything abnormal, any sudden sounds or unexplained sounds?
Sometimes when I get the tingles in my chest,
Okay.
I get a little ringing in my ears.
All right. So let's go ahead and check your ears. And how loud is that ringing?
I'd say it's quiet.
It's quiet, okay.
But enough that I can hear it.
So let's go ahead and see if you have any emerging ear infection. If you can look over to your left side. Just going to take a look with my otoscope. The auricle of the ear looks normal, no external discharge. Tympanic membrane is pearly gray, well-defined margins. I'm able to see all the bony landmarks. No signs of cerebral fluid buildup in the back of the ear. And you have the cleanest ears I have ever seen.
Thank you.
Okay, so that ear looks okay. I'm gonna go ahead and look at this one too. Okay, no external discharge. Do you feel any pain when I pull up one ear?
No.
Okay, let's take a look inside. No signs of any infection. And tympanic membrane is pearly gray. Well-defined margins. No wax buildup. Good. So from a physiological point of view, your ears are okay. Right. Let's go ahead and also test your hearing. So keep your eyes closed. And I'm going to make a sound and I want you to point towards the sound. Let's go ahead and look inside your ear for any sign of infection. Sorry. Next up, I'm gonna check your mouth for any signs of infection or anything emerging in the back of your throat. If you can open up your mouth for me, please. Okay. I see the uvula. Good. That looks quite normal. Have you noticed anything abnormal with your sense of taste? Any mixing of the tastes?
No.
Okay. I'm gonna focus on your nose next. Any problem smelling?
Only when I have the ringing in my ears.
Okay, so your sense of smell is impacted then?
Just a little bit though.
So let me go ahead and start by palpating the nose first to see if I can spot anything on the outside, and then we'll do a smell test. Okay. Any pain here?
No.
Any pain here?
No.
Okay, I'm pressing down on your sinuses. Any pain there?
No.
Any pain there?
No.
Any pain there?
No.
Okay, so sinuses are not inflamed. Okay. Take a deep breath in. Okay. And take another deep breath in through your nose. Nostrils are not obstructed. I'm gonna go ahead and give you something to smell. Can you tell me what it smells like?
It smells like flowers.
Flowers, okay? Yeah, that's it. It's a flowery smell. And now I'm going to give you another smell. And I'd like you to close up one of your nostrils. left or right, whichever one you want. Okay, let's see if you can identify the smell.
A little like toothpaste.
Toothpaste? This is supposed to be lemon.
Oh.
Okay, so I'm gonna make a note of that. Next up, I'm gonna go ahead and check the dermatomes on your chest and on your face. And the dermatomes are areas of the skin that are innervated by the same spinal nerves that are coming from your spine. So if any damage happens, I'll be able to detect it through the series of tests I'll be doing. So we're going to start off with the test that's called sharp or dull. May I have your palm? Okay, can you feel this?
Yes.
That's sharp. And can you feel this?
Yes.
That's dull. Okay, go ahead and keep your eyes closed to say sharp or dull. And I'll start with your forehead.
Sharp.
Okay, good.
Dull. Sharp.
Focusing on V2 now.
Dull.
Okay, good.
Sharp. Sharp. Dull.
Okay, so V2 and V1, which are the primary and secondary areas of your skin on your face, are clear. I'm gonna check out V3.
Sharp. Dull. Sharp. Dull. 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 Sharp. 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 Dull. Dull. Sharp. Sharp.
Okay, very well. So no neurodamage was noticed. Next up, I'm going to test your sensitivity to hot and cold, which is another way by which we can determine if any nerve damage is present. So I have here a slightly warm object and a very cold one. So keep your eyes closed and say hot or cold.
Warm.
Good.
Cold. 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 Warm. Cold. Warm. Warm. Cold.
Okay. So you mixed hot and cold a couple of times. I'm gonna make another note of this. So we have the sense of smell that is affected, and also the sense of touch. Not too sharp or dull, but cold or hot sensations are mixed up. Okay, let's go ahead and lay down, and I'll focus on your tummy first, and let's see if we can understand what's going on with the skin there.
Okay.
I'm checking your scalp for any abnormalities, folliculitis, psoriasis, anything that may contribute to those tingling sensations. The scalp and the hair are healthy. No breakages, no patches of lost hair, no signs of any alopecia, no ringworm, and you don't have any dandruff either. Okay, now move your head facing up. Just going to touch your face and palpate. No pain is indicated and no abnormal reactions to the touch. Okay, I'm gonna focus on the abdomen next. Okay, Amber, are you comfortable?
Mm-hmm.
Okay. Is it okay if I lift up your top a little bit and lower your pants to expose your abdomen?
Yes.
Okay. Right. I'm going to start with the visual inspection of the skin, the belly button, okay. I see a little bit of bruise here. Are you aware of it?
Yes.
Okay. Looks like it's healing. It has a little bit of a scab. That's all right. Okay, I'm not noting any blue or purple colors. No obvious swelling of the internal organs. I'm gonna go ahead and listen to the abdomen. I'm checking activity in all 4 quadrants. Not hearing any swooshing or gurgling. Good. So no abnormal sounds are heard. I'm gonna go ahead and do a light palpation. Check for any hidden masses. the spleen is not enlarged. The abdomen, the stomach has the normal size. I'm going to press down on your kidneys. Okay, good. And the liver, the tip of the liver is barely palpable. Good. Alright, I'm gonna go ahead and do percussion and check the resonance. Good. That's a good level of dullness. And we're going to do the same sharp or dull test. Do you feel this?
Yes.
Okay, was that sharp or dull?
Dull.
Okay, how about this?
Sharp.
Okay.
Dull. 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 Sharp. Dull. Sharp. Dull.
Okay, sensitivity to sharp and dull is as expected. Let's try hot and cold.
Cold.
Okay.
Hot. Cold. Cold. Hot. Cold. Hot.
So a little bit of mixing of the hot and cold sensations again. I'm continuing to suspect peripheral neuropathy. Right, let's go ahead and check out your legs and your feet as well. Okay, is it okay if I remove your socks, Amber?
Yes.
Okay, and I see the bandage down here. And can I also lift up the sleeves of your pants?
Yes.
Okay, I'm going to do a visual inspection first. A little bit of callus buildup, but that's quite normal. Can you wiggle your toes for me? Good, so you have good toe mobility. I'm gonna go ahead and palpate your calves and the plantar region of your legs. Okay, no signs of any edema. I do feel your legs warm and your feet quite cold. Is that normal for you?
Yes.
Okay. So not very good circulation to the outer extremities. Alright, let's focus on neurologically testing your left foot. Can you curl your toes around my finger? Good. And can you move just your big toe Right, and let's do the same with the other leg. Can you curl your toes around my finger? And now just move your big toe. Perfect. Okay, I'm going to do the Babinski test. So just let your leg loose into my arm. Good, negative Babinski. Let your leg loose. Good, negative Babinski. Okay. Do you feel that?
Yes.
And that?
Yes.
Okay. Any pain there?
No.
Okay. Do you feel this?
Yes.
And this?
Yes.
Okay. Do you feel that?
Yes.
That?
Yes.
Okay. You feel that?
Yes.
Okay, just say yes when you feel it.
Yes. Yes.
Good. So sharp sensitivity is retained. And do you feel this?
Yes.
And is this sharp or dull?
Sharp.
And how about this?
Dull.
Good. Sharp and dull sensitivity is retained. Okay. Going to inspect in between your toes. Okay. Good. Okay. Going to check your pedal pulse. To plus synchronized. Can you flex this leg all the way towards your head? Good. And down. And can you do the same with your left one? Good. And then down. Can you rotate this foot? Good. And now rotate your right foot. Good. Now I'm going to attempt to spread your legs apart. Don't let me do that. Now I'm going to attempt to bring them together. Don't let me do that. Okay, good. And now push into my palms with your heels. Good. Okay. So legs and feet exam showed no positive findings from a neurological point of view. You're all healthy. The abdomen also presented very well, except the mixing of the hot and cold sensations again. But other than that, everything was okay. So I do suspect the onset of peripheral neuropathy. So I'm going to prescribe that we do a set of tests. So I want you to get your blood drawn and just write a quick note about that. We're going to do some blood tests and confirm the clinical diagnosis. Blood tests, peripheral neuropathy. And let's monitor the symptoms and see how they progress over the next couple of months. And I'll see you again in about 3 months. And we'll also review the blood results in the meantime. And if it turns out that it is a positive diagnosis, then I want you to come in sooner so we can discuss the next steps.
Okay.
Do you have any questions for me, Amber?
I don't think so, no.
Okay, good. Nice seeing you today then.
It's good to see you.